Collaborative and Proactive Solutions is the new name of the model I originated in my books, The Explosive Child and Lost at School. It's a very different model. It focuses on non-punitive, non-adversarial, skill-building, relationship-enhancing, proactive ways of helping adults collaborate with kids on solving the problems that affect kids' lives. It's been around since The Explosive Child came out in 1998, and more recently has found its way into Norway in the last 4 or 5 years. For a long time, other models have been very focused on a kid's behavior and teaching adults how to modify that behavior. And that's actually not what you're doing when you're implementing CPS. And that's true whether you're doing CPS in a family, or in a school, or in a facility, or in a prison. And those are all places where CPS has been implemented. In CPS, you're not focused on behavior and modifying it. You're focused on the problems that are giving rise to those behaviors and solving them. And that is a very big difference. What I like to refer to CPS as is an upstream model. Behavior is downstream. Behavior is what's happening because of the problems. But in this model, we are paddling upstream. We're trying to figure out what problems are causing those behaviors, and we're trying to solve those problems. Because here's what I find. If you try to modify behavior, you may well improve the child's behavior, but you will solve none of the problems that are causing those behaviors. But what the research tells us is that if you are solving the problems, not only are you solving the problems, you are also improving their behaviors at least as much as you would be if you were modifying those behaviors. So this is a problem-solving model, not a behavior modification model. And that is a huge difference right off the bat. But also, in this model, instead of solving those problems unilaterally, which is where the adult comes up with the solution and imposes it on the kid, which is kind of, adults are real keen on solving problems that way. In this model, we operate on a very important assumption. If you want to solve a problem with a kid, you're going to need a teammate. You're going to need a partner. Who's your partner? The kid. This is problem solving of the collaborative variety. This is a partnership between adult and kid, whether that adult is a parent, or a teacher, or a staff member in a facility. This is kid and adult partnering to solve the problems that are causing the behaviors that we don't like. If we're going to be solving problems that way, the other big difference in this model is we're going to be doing it proactively, not emergently. A lot of the intervention that takes place for behaviorally challenging kids takes place in the heat of the moment, emergently, reactively, which is very bad timing in the problem-solving department. Truth is, it's actually not that great a timing in the behavior modification department, but it is definitely not good timing in the problem-solving department. But that often raises the question, if we're going to be trying to solve these problems proactively, how can we do that if this kid's challenging episodes are so unpredictable and occur out of the blue? The answer: this kid's challenging episodes do not occur unpredictably and out of the blue. I think these are the most predictable kids in the world. But we have to make them predictable by putting the hard work in up front to figure out what the problems are that are causing those behaviors ahead of time, so we can figure that out, decide which ones we're working on right now and which ones we're not, and then get busy solving problems proactively. There are now 2 studies in very good psychology journals showing that when you compare CPS, Collaborative and Proactive Solutions, to PMT, Parent Management Training, which is roughly the reward and punishment approach, the studies tell us that CPS is at least as effective as the reward and punishment approach. So people aren't losing any ground by collaborating with kids on solving the problems that are causing those behaviors. But what the research also tells us in outpatient settings is that when you are engaged in CPS with a kid, the kid is much more likely to participate in problem solving than when you're doing rewarding and punishing. Because in rewarding and punishing, there really is no collaboration on solving problems. There's just the adult telling the kid what to do and giving the kid the incentive to do it. So the research tells us that CPS is now what's known as an empirically supported treatment. That means it's well established. That's good, but there are also studies on CPS showing that it is very effective in inpatient psychiatry units, where it has now a track record. There are at least 2 studies showing this. It has a great track record for significantly reducing use of restraint, seclusion in those kinds of facilities. There is unpublished data at the moment from schools and juvenile detention settings that won't be unpublished for much longer, but we just haven't been able to find the time to write all these papers up yet. But in schools, the model has been shown to significantly reduce detentions, suspensions, and discipline referrals. And in prisons, it has been shown to dramatically reduce the use of hands-on procedures like restraint, locked door seclusion, in other words, solitary confinement, staff and kid injuries. If you're laying hands on kids less, because you don't see the point in laying hands on kids anymore, except under very extreme circumstances, which also are rather predictable, then both the kids and the staff are going to get hurt less. And in the juvenile detention system in the state of Maine, whose recidivism rate was 65% 8 or 9 years ago, the recidivism rate now is between 15 and 30%. Those are statistics that suggest that when you view kids through different lenses and when you intervene in ways that are more compassionate and more effective, the data tell the tale. Parents and schools and facilities have to get good at 2 parts of the model. They have to get good at using the assessment instrumentation, and it's called, there's an instrument that I have developed called the Assessment of Lagging Skills and Unsolved Problems, in which we are identifying the skills that are making it very difficult for this kid to respond to problems in an adaptive fashion, and identify the problems that are being caused by those lagging skills. What expectations is this kid having difficulty meeting because of the skills that he or she is lacking? Identifying the lagging skills helps us get the right lenses on, because we really want to come see this kid as lacking in skills rather than lacking in motivation. We've been viewing behaviorally challenging kids as lacking in motivation for a very long time. And that's why we've been applying motivational strategies, rewarding and punishing, for such a long time. And a lot of kids have not benefited from those lenses or from those interventions. Instead, we want to help caregivers come to recognize these kids are lacking skills, not motivation. What skills? There's lots of them, but the global skills are in the domains of flexibility, adaptability, frustration tolerance, problem solving. When adults come to recognize that kids are lacking skills rather than motivation, they start to see these kids through completely different lenses. They start being much more compassionate. They now understand what's really been getting in this kid's way. Once we figure out what the unsolved problems are, we can start solving those problems collaboratively and proactively. So the second part of the model that people need to get good at, and both of these parts, both getting good at the assessment of lagging skills and unsolved problems, hard, but not that hard, just takes some practice. Getting good at solving problems collaboratively, hard, not that hard, just takes some practice. It especially takes practice for most adults, because adults are accustomed to solving problems with kids unilaterally. That's where you just tell the kid what the solution is, you impose it on him, and you make sure he does it. That's not a partnership. That's not collaboration. The hard thing for many adults, the hardest part for many adults, is learning how to collaborate with kids on solutions. That can be very difficult for adults who are accustomed to telling a kid what to do and making sure he does it. And yet, what we find is that when adults are telling kids what to do and making sure they do it, that's why challenging kids are challenging. Challenging kids you can get away with telling a kid what to do and making sure he does it if he's not very behaviorally challenging. But if he's behaviorally challenging, telling him what to do and making him do it is a very good way to set in motion a challenging episode. Hitting, screaming, swearing, spitting, biting, you name it. A lot of the times those behaviors on the part of the kid are set in motion by the adult telling the kid what to do and making sure he does it, by the adult solving a problem, an expectation that the kid is having difficulty meeting. The adult is the one who came up with the solution, and the adult is imposing it on the kid. What we help people get good at in this model is how not to do that. You're still solving the problem, but instead of solving it unilaterally, in a way that quite frankly actually doesn't usually get the problem solved and causes a challenging episode, now you're solving it collaboratively. That does get the problem solved, and it doesn't cause a challenging episode. So what I put most of my time into is helping parents and teachers and staff members in facilities see these kids through the right lenses, identify their lagging skills and unsolved problems, and learn how to solve problems collaboratively. What the research tells us is that when you are solving problems collaboratively and proactively with kids, you are also indirectly teaching them the skills that they are lacking. I view challenging behavior as a developmental delay. A developmental delay means a kid is lacking skills. In that respect, and that's the most important respect, it is no different than a kid who's having difficulty reading. A kid who's having difficulty reading is lacking the skills required for being proficient in reading. A kid with social, emotional, and behavioral challenges is lacking the skills required for being proficient in handling life's social, emotional, and behavioral challenges. Both are developmental delays. Now we have to ask the question, why do we handle the developmental delay that is reading in such a different way that we handle the developmental delay that often results in challenging behavior? We shouldn't. But often the kid who's having difficulty in reading gets far more compassion from us, far more empathy, than the kid who's having difficulty with his behavior. What I'm always telling people is, behavior is just the signal. Behavior is just the way in which a kid is communicating. You are placing demands upon me, demands and expectations that I am having difficulty meeting. How do you know I'm having difficulty meeting it? I am now exhibiting a behavior that you don't like, which is the way in which I am communicating that I'm lacking the skills to handle that demand or expectation. If all we do is focus on the behavior, all we will think to do is modify the behavior. But if we instead see behavior as a mechanism by which the kid is communicating, simply as the signal, then we can move beyond the behavior, figure out what problem caused the behavior, what expectation was the kid really having difficulty meeting, and then we can partner with the kid, collaborate with the kid to get that problem solved. All of that happens when we move beyond behavior, when we stop seeing behavior as the end and see behavior as just the signal, just the way in which the kid is communicating. I am struggling. We help kids stop struggling in this model by figuring out what problems they're struggling over and helping solve those problems in a way that is collaborative as partners. You can't say anything about Scandinavia that's true of all of Scandinavia or all Scandinavians, but my sense is that Scandinavia in general has a pretty long tradition of being non-punitive and non-adversarial in its interactions with kids. And, as evidence of that, a lot of the Scandinavian countries were among the first to get rid of spanking, hitting kids, right? There are still some countries in the world, including the one I live in which spanking is still not only extremely popular, but also legal and practiced in our schools. Sad, here in the year 2015, that we are still hitting kids, often in schools in the United States, with a piece of wood. All hitting the kid on the butt with a piece of wood tells the kid is that we don't like what he did. He already knows that we don't like what he did. He also already knows what we wished he'd have done instead. So he doesn't need another reminder on that, and he certainly doesn't need adults hitting him. Suspension doesn't solve problems. Detention doesn't solve problems. Expulsion doesn't solve problems. Timeouts don't solve problems. And for goodness sakes, stickers do not solve problems. All those interventions do is remind the kid and give him the incentive to do what we want him to do and to not behave in the ways that we don't want him to behave. But if the ways in which he's behaving are being caused by problems that he's having difficulty solving, it becomes crystal clear why those interventions are frequently ineffective. Those interventions do not solve the problems that are causing the kid's behavior in the first place. So my impression is that Scandinavia has a long tradition of being non-adversarial and non-punitive with kids. I think that is a wonderful thing, and I think that probably accounts for why people in Scandinavia have embraced the model. I do quite a few workshops in Scandinavia, have always done a lot of speaking in Sweden and Denmark, and some in Finland, and some in Iceland, increasingly so in Norway, thanks to FamLab. I suspect that that relationship will continue, so I think people should watch the FamLab website in Norway to see when I'm going to be here. And I do different levels of training in Norway. Some are introductory, some are more advanced, so there's always options there. And if I'm not coming to Norway quickly enough for people, and I'm usually here once or twice a year at least, people can get on the website of my nonprofit, livesinthebalance.org, and access all kinds of free resources on the model, more resources than people can imagine. And they're all free, and they're all waiting for people on the Lives in the Balance website. And we are working hard now at putting a lot of those resources into Norwegian instead of just English, so that it's even more accessible for people in Norway. There is a certification training that I do that is 6 to 7 months, but it's conducted by teleconference so that people can stay in Norway and still become highly proficient in the model. And then they become certified providers so that they can provide the model here in Norway. And eventually there will be people in Norway who are speaking on the model as well, because why should Norwegians have to wait until I come to Norway to hear about the model? And why should they have to hear about it in English? I've noticed that people in Norway tend to speak very good English, but it sure would be nice, and this is going to be starting to happen, that there be some people in Norway who are able to educate others on the model as well.